Our vein procedures really don't hurt, but we do use Novocaine to numb up the areas so that you don't feel the treatment. Some patients have needle phobia, or they've had bad experience, or they just don't like the needles. It's like going to the dentist. A lot of the dental work doesn't hurt, but getting those injections does, and they often offer nitrous oxide at dentist's office. Pro-Nox is a brand name for a combination of oxygen and nitrogen, and it's used for simple outpatient procedures or in-office procedures. At least 10% of our patients prefer to use the Pro-Nox during the procedure, and it helps treat anxiety and reduces the pain, and it helps people get through the procedures to get good results, which we're after, but we don't want to torture patients too. So this really helps get us treatment. It's good for us proceduralists too, because if the patient's more comfortable, we're getting through the procedure easier as well. I had my veins treated a year ago, and I tried one radiofrequency ablation, which involves between 6 and 8 injections to get the vein numbed, and I tried one on my other leg with this, and in my opinion, it made it a lot easier. And there were no real side effects of it. I had my veins treated at lunch and saw patients the rest of the day, because the nitrous oxide wears off within several minutes. In fact, patients are allowed to drive 10 minutes afterwards. We use some tubes, it connects to a device here. Here's our tanks, oxygen and nitrous oxide, and the patient puts this in their mouth and breathes, and it exhales through the tube. There's one-way valves that allow the gas to enter as they breathe. And then if everything's quiet and we're doing some work with no injections, they can just put the handpiece down. Side effect of it is that you start feeling a little lightheaded if you get too much of it. So you just stop breathing it. Don't breathe as deep. If patient is feeling the procedure more, I have them take deeper breaths to get delivery of more medicine. Helps relax them more. The dose is dependent on how much you breathe. So we coach the patients to do slow, steady breathing. In fact, one patient she did so well on it. I was like, wow, we should have you coach other patients. Well, she was a scuba instructor. So she got the breathing down. You just keep that in your mouth, you just breathe nice, slow and steady, and it works nice. There's no reason not to get your veins treated if you don't like the appearance or if your legs are bothering you, because the procedures to treat the veins are very patient friendly. And if you opt to go with the Pro-Nox, you don't really have to even deal with the discomfort of getting the lidocaine injections.
Go to cincyveins.com and schedule a consultation today. The Vein Center of Cincinnati, your center for vein health.